Hello, my name is Taylor Ferrucci. Today is October 6, 2022, and today I'm gonna play the game of What Could It Be? We're doing an infectious and non-infectious disease course, and let's guess what disease this could be affecting our patient today. So listen closely. I'm gonna present a patient to my doctor and make guesses along the way as to what this disease could possibly be. This is Dustin. She's a 2-year-old spayed female Labrador mix. Her chief complaint is a second opinion for waxing and waning lethargy, vomiting, diarrhea, hyporexia, and anorexia. The pet is mostly anorexic, but when she does eat, she's eating less. She has been to 2 other animal hospitals over the last almost her entire lifespan since 6 months of age. She's always been deemed presenting healthy. The current prognosis is suspected inflammatory bowel disease. She's got no coughing or sneezing and is up to date on vaccines. Temperature is 100.9 degrees Fahrenheit. Pulse is 80 beats per minute. Respiratory 50 breaths per minute. Body score is 5 out of 9. And the fear, anxiety, stress score is going to be a 4 out of 5. She's a little fearful. The pet is currently on topical Revolution. The owner is feeding a Royal Canin hydrolyzed protein diet exclusively, and that's been going on for the last 3 months. She's also feeding Fortiflora once a day for the last 3 months, and after looking at the manufacturer's instructions, Fortiflora is a hydrolyzed, so they are completely compliant with that diet. When the doctor does their exam, they note the exam's unremarkable. Yet again, this pet presents healthy for a physical exam. What could it be? The doctor orders a complete blood cell count, a chemistry, a T4 test, a urinalysis, a CPL for pancreatitis, a fecal test with Giardia, a Texas GI panel, an IDEX GI panel, and an IDEX canine diarrhea panel. The owner wants answers, so they agree to do all of the testing listed. So what do you think it could be? Does it sound like inflammatory bowel disease? Could it be whipworms, chronic pancreatitis, possibly pancreatic insufficiency, or something else entirely? So finally, our blood work for Dustin is back. Let's take a look at those results. We can immediately rule out whipworms. The fecal is negative. Inflammatory bowel disease is looking less likely due to the owner exclusively feeding hydrolyzed protein options and even doing topical prevention. Pancreatitis, we were negative. There were no abnormalities. Also, the GI panels and the diarrhea panel are negative. Everything was normal. And so was the CBC and T4. So we're ruling out thyroid issues. The sodium potassium ratio is 27. There's mild hypoglycemia. BUN and creatinine are on the high side of normal. So what could it be? The hypoglycemia could be due to the anorexia. Elevated BUN and creatinine could possibly be due to dehydration. Or is it? Maybe we've missed something in Dustin's last exam. So the doctor takes a look back at the notes. And what do you know? Another piece to the puzzle. Did anybody notice that Dustin's heart rate was slightly low for such a fearful dog? She's suffering from bradycardia, which is yet another piece to the puzzle. And if she was so fearful at her visit, her chemistry was normal. White blood cell count didn't go up. So does that explain our hypoglycemia? The doctor asked Dustin to come back one more time for an HCTH stem test. So Dustin comes back for testing and the bradycardia is confirmed. Her blood was drawn. Cortisol, which is a synthetic ACTH, was given IV. Her blood was drawn again 1 hour after the cortisone was given. And no cortisol was stimulated by the testing. So in a normal dog here, when cortisone is given, we will see a response. And in a dog with hypoadrenal corticism, you're going to see no cortisol was produced. Her body was unable to produce cortisol. Therefore, we are left with Addison's disease, which is also referred to as the Great Pretender's disease, which is why all of her symptoms looked like anything and everything. So, what is this Great Pretender's disease, Addison's? It's going to be atrophy of the adrenal cortex. So the adrenal glands are going to sit on top of the kidneys here, and particularly it's going to be the cortex out here that is affected with Addison's disease, because that cortex produces glucocorticoids or corticosteroids and mineral lactose and sex hormones. So normally the hypothalamus is going to produce CRH to the pituitary gland. The pituitary gland is going to produce ACTH, which will then tell the adrenal glands to produce cortisol. In an Addisonian dog, they're not going to produce this cortisol no matter how much ACTH is produced. And this is really important. Cortisol is critical to life and helps keeps the body's homeostasis in balance. So how did the doctor think to test for this? It is an uncommon disease in dogs, but it does disproportionately affect certain breeds. This is one of the reasons why signalment is so important. The most common breed to get this disease is poodles, but it's also seen in Labradors. Dustin's a Labrador mix. It's most common in middle-aged dogs, but it can be seen in younger dogs. It's rare in cats, and the cause is, for the most part, unknown. It's most often idiopathic. So they're not sure why the adrenal glands do atrophy, though it can be hereditary, which is why we see it in certain breeds more often than others. And when the adrenal glands are damaged, they're unable to produce these two critical hormones, and when mineralocorticoids are unregulated, this affects the sodium-potassium exchange. That's why Dustin's sodium-potassium ratio was 27, which was a little low and a clue as to she might be suffering from Addison's. So this abnormality really can cause a lot of her symptoms. Dogs with low sodium-potassium ratios suffer from vomiting, diarrhea, lethargy commonly. So what's our treatment? That really depends on our patient. If we have an acute critical patient that's in an Addisonian crisis, they are most likely near comatose. So what we need to do is administer normal saline, get their sodium-potassium ratio back to normal. We need to supplement for the corticosteroids that they're unable to produce. And this is typically done through injections for rapid onset. If we have a chronic case who's going to be much more alert, we can start with oral steroid supplements and injections to produce what the adrenal glands are not. It's all about getting the body back to homeostasis with treatment. And we also want to always monitor electrolytes regularly. When the electrolytes go completely out of whack, that's when crisis becomes critical. Dogs with Addison's tend to have a very positive prognosis. However, when they go into crisis, where they become comatose like this, they are at risk of death, and oftentimes it is sudden in onset. So, Dustin is my atypical Addison's dog. This is the face of the Great Pretender's disease here. She is 3 years old now, and she actually suffers from atypical Addison's disease. So the story you heard on the first slide was completely true. She saw 6 different veterinarians over 2.5 years till she finally got her diagnosis. The second slide was not true because with atypical Addison's, These dogs will actually have completely normal blood work except for the ACTH stem test, because their sodium potassium channels are going to be exchanging like normal. The only thing they're not producing is cortisol, which is why it's going to show up on that ACTH stem test. She had been suffering from this from about 6 months of age, and so she has made a complete recovery with the help of her best friend, prednisone. She just gets a little white tablet every day, and now she's over here living her best life. As I mentioned, most frequently they have really good prognosis as long as blood work is monitored regularly and owners can maintain giving the medications at regular intervals. Thank you, guys.